Thank you, Madam Deputy Speaker. So I would like to rise to speak on Lord's Amendments 1, 2, 3 and 4. The Liberal Democrats are extremely concerned that this tax rise risks having dire consequences for social care, primary care, the NHS, hospitals and charities, many of whom are delivering vital healthcare in the community. Thousands of care providers already on the brink of bankruptcy, and this national insurance increase risks tipping them over the edge. The OBR estimates that this hike will bring in £10 billion a year, rather than the £25 billion estimated by the government, once employers change their behaviour in response to the tax, and once public sector employers are compensated. Yes, we know finances are stretched, and the government inherited an incredibly difficult situation, but we do believe the government could have raised that amount of money through much fairer tax changes, and we have come up with many suggestions on these benches. For example, they could have reversed Conservative cuts handed to the big banks, increased the digital services tax, doubled the rate of remote gaming duty, introduced a fair reform of capital gains tax so that the 0.1% of ultra-wealthy individuals pay their fair share. And it may be something particular to Totnes, but I have many wealthy constituents who have told me that they wish they were being asked to pay more tax. Liberal Democrats have called on the government to exempt social care providers and GPs from the employers' national insurance tax rise. On average, the tax rise is going to cost each GP practice an estimated £20,000 a year. The government have announced an additional £889 million into the 25-26 GP contract, but they have failed to spell out how much of that they believe practices will need to use to pay the additional tax burden and how much will be left to meet unmet patient needs. What is clear is that the NI rise will mean that the uplift to the GP contract is in fact far smaller than it appears, because a proportion will need to be returned directly to the Treasury, as many members have said, robbing Peter to pay Paul. So what assessment has the government made of how much of the recent uplift in the GP contract will practices need to use to offset the recent rise in national insurance? Rowcroft Hospice, in my next door to my constituency, but which serves us, says the NIC rise is expected to add £225,000 to annual costs. One of my GP surgeries says their costs will go up by £187,000, and the Devon Mental Health Alliance estimates the cost increase at £375,000, which potentially results in a loss of 25,167 staffing hours. One GP said to us, "I have been a GP for 10 years and a doctor for 15. It's exhausting, and I feel like just giving up, frankly. This is not an attractive or stable job for training doctors." And the Devon Mental Health Alliance, which is a strategic partnership uniting 5 leading charitable organisations in Devon, they said, "As a sector, we play a critical role in easing the burden on the NHS by preventing thousands of people from needing GP appointments, hospital care or sitting on waiting lists for treatment. By addressing health issues at their root and offering early intervention and prevention, this sector acts as a frontline defence, reducing demand on overstretched NHS services. They cannot fill the black hole by increasing revenue efficiencies or risk management." They estimate their costs at £375,000 next year, and as I've said, it could mean 25,000 staffing hours lost. That would mean that more people in Devon with complex needs will not be able to access their services. Minister, at a time when we have a mental health crisis across all ages and communities, this extra financial impact on voluntary sector services is short-sighted and will only heap more pressure on the NHS. If we don't value the work done in primary care, particularly by GPs, we are putting the health of our constituents across the country at risk, putting more pressure on GPs who are already working at full capacity, and threatening reforms to the NHS, which has already been brought to its knees by chronic underfunding over the last decade. I strongly urge the government to reconsider the NIC rise for GPs, social care providers and all of those working to support health and well-being in the communities we represent. And just to finish, I would like to echo what others have said about the total absence of backbenchers from the government benches who felt able to come in and speak in support of their hospices and their social care providers and their voluntary sector organisations, because they cannot come in here and defend a government policy which they know is indefensible.